Assalamu alaikum, the communication day. First scenario, Mrs. Annie Johnson, 37 years old, came to the hospital complaining of shortness of breath, fever, and weight loss. She was admitted to the hospital and self-discharged. Her chest X-ray showed features of pulmonary tuberculosis. ESR was 107. Her sputum smear is positive for acid-fast bacilli. Explain the result of her tests. Her diagnosis of tuberculosis, address any concern she may have. Here you go.
Hello,
Hello.
you are Miss Anne, 37-year-old.
Yes, I am, doctor.
I am Dr. Ahmed. I'm doctor in the clinic today. Uh, Today we are here to discuss some issue related to your health condition and address your concern. Is it okay with you?
Yes, it's okay.
Do you want anyone to attend this meeting with you?
No, doctor.
Okay. Miss Anne, can you tell me how much far you know about your condition?
Well, right, doctor. I've been feeling unwell for the past few days, and I came to the hospital. I was short of breath, I had high body temperature, and I've been also losing some weight. So they did some tests for me, and I had to go back home. And when the results came out, then they rang me, and I came here to know what's
Okay.
happening with me.
Okay. I'm sorry for what you are feeling now. Now you are okay?
Yes, I'm okay, doctor. I'm just a bit anxious. I want to know what's happening with me.
Okay. You do you have any expectation for the result?
No, doctor, nothing.
Okay. Do you want me to explain to you?
Yes, please.
Uh, Miss Anne, the result of your investigation is not as we hope, uh, and
What do you
this
mean,
show
doctor?
that you, show that there is a bug in your lung. You have a condition called tuberculosis, dr. buzzer by the name pulmonary tuberculosis. This is bug in your lung. Is it okay with
Oh
you? You
God.
are follow me?
Yes, I'm following, doctor. Is it tuberculosis, the nasty bug infection of the lung?
Yes, this is a bug infection. Primary affect lung and can affect other side in the body, but primary affect your lung.
Okay.
Uh, so we need to admit you and start treatment.
Is it serious, doctor?
It is serious if left untreated,
Okay.
but it's a treatable condition. Uh, and we can give you a tablet, and we need to isolate you in isolation room specific for this specific bacteria called mycobacterium. Uh, will be admitted in isolation in isolated room.
What do you mean, doctor? How long do I have to stay in the hospital?
Uh, you will be isolated until clear from infection,
Okay, like
because this is has a risk of
how many days, doctor?
um,
Because I can't stay much in
uh,
the hospital.
um, to be honest with you, I'm not sure about what time exactly need to be admitted in the hospital, but I will check and I will give you feedback.
Okay, but I can't stay long because um I have to be home.
Uh, I will check. I will give you back as soon as possible about this information. Do you have anyone at home has a cough also?
Well, one of my children has been coughing the past week as well, but um I'm not sure. He hasn't has any like
Mm.
high temperature or anything. could I have passed this infection to my child, doctor?
Yes, as I inform you, this is bug infection and is highly infectious and can give infection to anyone contact with you, uh, and anyone contact can get the infection and can develop symptom like cough, like chest pain, like sometimes weight loss and fever also and night sweat. So anyone contact with you at home, we need to test him also.
Okay, doctor.
And
But
do you have?
can
Tell
I
me.
can I isolate home? Like I can stay at home and not go out. I want to be home because I have to care for my children.
I highly appreciate your concern, but as I mentioned to you, this is a serious condition can be spread very quickly. So if you stay at home, this will be not safe for your family. Maybe all family will be affected by this condition.
Okay.
If you have some issue for regarding this problem, we can contact social worker and even occupational worker. We can help you about this regard.
Okay, doctor.
Uh, can I
And
ask you?
what are the complications of this condition? Like, what is the worst that
Uh,
can happen to me?
Hello, tell me.
What is the worst that can happen to me? What are the complications of this bug infection? Because I know tuberculosis is a very nasty bug infection for the lung. I heard about it
Yeah,
before.
yes. Okay. This is can cause lung like to be fibrosed and also can cause a scarring in the lung and can cause airway will be like obstructed or like stenosis and also can develop a secondary infection. Other infection can come also, uh, and even sometimes can develop also like fluid in your lung. Okay? And also there is a layer covering the lung can be also be sick as a complication of this is bug infection and affect breathing also.
But how do you think I
And
got this infection, doctor? Because we have a very good hygiene at home, and I don't remember being near a sick person. How did I get it?
this is always maybe got it by contact with anyone has uh, chronic cough diagnosed by this condition.
Okay.
So can I ask you some social question?
Yes, please.
What do you do for living?
I'm a teacher, doctor.
Uh, are you financially supported?
Yes, I am.
Do you smoke?
No, I don't smoke.
That is good. Do you drink alcohol?
No, I don't drink.
This is condition affect your impact in your life, affect your life.
Yes, I'm continuously tired the past few days, and
2 minutes
I'm
left.
I'm very worried, doctor, because I work with students. Do you think I could have passed this to my students?
Uh, Contact with a student in a closed room. Maybe need also to test it. All student, maybe anyone contact with you need to be tested for this bug infection. But if it is a ventilated room and good air entry and good hygiene, less likely to be infected. But to be safe for kids, better to be tested.
Okay. And
We
doctor,
can
you say,
contact infectious control and test it here.
right, okay. So doctor, you say I have to isolate in the hospital. Does that mean that I'm not going to go to work? Are you
Yes,
going to tell my employer?
yes, sure. I will give you sick leave for this problem, and I will also contact a social worker to help you regarding your any home issue, and support you, because this will should be stay in a private room with a good ventilation, called negative pressure. Don't buzzer by name, but this is called negative pressure room. Okay.
Thank you, doctor.
Good. Thank you. Do you have any other concern?
No, thank you.
I will give you some leaflet and some brochure to read more about this condition. Is it okay?
Okay, thank you, doctor.
Thank you very much.
Okay, thank you, Dr. Salma. I will ask you one question. Do you think she's agreed to be isolated and to take medication? Do you feel that?
Um, yes, has some issue, but we try to solve her issue that
Yeah.
prevent her from
Okay, but how much you are sure about that? That she's agreed. Okay, let's hear Dr. Lamis
need to ask her
comment.
direct questions that you are willing to now you are willing to stay
Exactly,
with us.
yes. Yeah.
Yeah,
Okay,
so
okay.
basically
Okay.
you have to look at the end
So you can
if
comment now, Dr. Lamis. Yeah, go ahead. Sorry.
yes, thank you, Dr. Basim. So basically a few things with the scenario. You have to ask at the end because in the scenario they that I sent, they put like she self-discharged. So it's not an issue, but it's just pointing that she's not willing to stay in the hospital. So you have to explore. Um, Sometimes the surrogate will not tell. She will just insist on she needs to go back home. She doesn't want to isolate in the hospital. So you have to explore, is there any reason why you don't want to go back home? And then explain the importance. If she keeps insisting and insisting, then what you can offer, say that we'll leave it to the public health department and the TB specialist in some instances where you cannot isolate in the hospital. Sometimes they do evaluate if you're suitable for self-isolation, but we cannot guarantee anything. But it's important to isolate in the hospital, and you specify the period. So she asked for the period because she wants to determine whether she can stay for that period or not. So usually the answer to that is 2 to 3 weeks. But say we will consult with infection control, and we need 2 phlegm tests to come back negative for you to be safe to be discharged and come up from the isolation. In regards to the being convinced or not, so you have to wrap up at the end and say, do you agree to isolate? Are you okay with that now? We will have another meeting to discuss and give you further information about your isolation. So you don't have to go into details like it's a negative pressure room or things. You can like invest the time in other things.
Mm-hmm.
Um,
2 weeks. Need to admit 2 weeks.
yeah, it's you say 2 to 3 weeks, and
Yeah,
we
the
are going
minimum
to
is two
repeat.
weeks. Yes, at least 2 weeks.
Is 2 weeks. Yes, it's two
Okay.
to 3 weeks, and we have to do repeat your phlegm test again, and it has to come back negative twice.
Okay.
So that's the part of the clinical judgment, is you have to know when she's going to come up. If you're not, you forget the timing, then you can say like at least when you have the phlegm test coming back negative.
Mm-hmm. Yes, yes, yes.
Okay, so the surrogate asks a question, how did I get it? So in the beginning, if you tell her like explain this is a bug infection of the lung, usually you get this kind of bug infection by breathing in a common space. It's through droplets where you come in contact with someone who has this infection. So if you say this, then she wouldn't like ask this question later on.
Mm-hmm.
Then, so this, you covered the definition, then the mode of spread, then the symptoms are the same symptoms as he's having. Team of doctor was important, say TB specialist, TB nurse, infection control, and a chest doctor or lung doctor. One important point, you covered it, but if you make it like clearer about the contact tracing. Here,
Yes.
the surrogate prompted the contact tracing when she asked about the children, like my child is coughing now. One of the
Yes.
things you mentioned is we will contact the public health and they will do the contact tracing. They will determine anyone you've been in contact with at risk, and they will do the contact tracing to check if anyone needs to be treated.
Yes. What about the school? What about the student in school? Also
Yes,
need to be tested because I'm not sure
yes, the
100%.
school. So you will just say the public health department. They will do the contact tracing, including your family and any contacts you've come close with, maybe the students as well.
Okay.
One part regarding the medications, you don't have to go regarding the medications because there's a lot of details about the anti-TB treatment. So you will say you will have to, there are some medications you'll be given, you need to be very compliant, and they have some side effects that we will explain to you in more details. One important point is because she's a female, so you have to touch on the pregnancy and the pill. So we say pregnancy needs to be planned, and also if she's taking any oral contraception, these interfere with your medication. So we need to involve the women's doctor.
Okay.
Otherwise, it's just like what you did. These are only the points that you missed.
Thank you.
Okay, are you done, Dr. Lamis?
Yes, I think there is one thing if you can comment on it, Dr. Basim, is the invitation early on in the
Exactly,
scenario.
yes. Yeah,
Yes, so
this
I think she should not invite, and she should ensure confidentiality rather.
perfect. Yes, this is what I was about to say. Any infectious disease, so it's not advisable to add or to invite anyone. Something might be uh, very confidential for those people. She might tell you why, doctor, is something sensitive. Yeah, the result here is related to infectious disease and might tell you, I don't want anyone to tell or to know about my condition. You'll be in trouble. If she said that, the welfare might be
Sorry, Dr.
affected.
Basim, this point again. What about this point?
Yeah, if she told you, doctor, I don't want anyone to know about this condition, you
Yes.
breach the confidentiality. So don't invite. I usually say,
Okay, okay, okay,
okay,
okay.
yeah, don't
فكل
invite
all
infectious
infectious
disease.
I didn't mention
Yes,
biology.
exactly. Any infectious disease, particularly the sexually one, okay, sexually transmitted disease, and any genetic condition that might be also sensitive, like Huntington or Hockham, or any genetic disease that, like, that the people will not, they don't want to share them with other family member, even with family member. She might tell you, I tell my husband, but don't be the one inviting the husband, okay?
Mhm.
Particularly in the introduction while you are explaining a disease. Okay. The expectation and introduction went good. Before commenting, Dr. Lamis, you can read the scenario, your scenario, and I will read it loudly later on. But
Okay.
be ready, okay? Try to prepare yourself. I will comment quickly, then I will be back to you. So the introduction went good, Dr. Salma. The other thing, the expectation also, but I didn't hear that you are warning the patient or giving the warning shot or silence, golden silence. Although the TB is
Mm.
one of the curable disease, But still, if the patient doesn't or didn't take the medication, it might end up with respiratory failure.
Well,
So
Mm.
I
she
prefer,
said, sorry, Dr. Basim, she said she has the results and the results are not as she hopes or as we hope. She said something about the
Yes, yes,
but
I tell like this.
yes.
but
What
I
should
didn't
be
hear.
mentioned?
Yeah, I didn't hear that you give the golden silence. You continue explaining quickly without silence. What I want
Mm.
you to say. So the result now are with me, and there is something concerning.
Mm.
Okay, you have a condition called pulmonary tuberculosis. Have you ever heard about it in this way? Okay, then give her some
Mhm.
time to react. She might tell you, "Oh my God, doctor, this is the infection of the lung. This is the horrible infection of the lung. I heard about it." Whatever she will mention, then you can also give her some time to react. Then you start to explain and to tell her either it's the same what she expected or something else different than she expected. Okay, so do it in the conversation way, not as explaining only. Let her react,
Mm.
then you explain, then let her react, then tell another. What I want also you to do, the pathophysiology you have to do, to mention why you have
Mm.
this infection, not as a question, as information. So usually this bug comes while you are in contact with sick patient who is coughing.
Mm. Yes,
And
they ask me, I'm good hygiene.
yeah,
Why
mm,
I got a.
okay,
Mm.
what you can add to this sentence, if you want to say, in particular, what do you think the most important and what is the most common cause of tuberculosis infection spreading? And it comes in phases.
Unventilated room.
Not only that, travel history,
Uh-huh.
right? So you can say it might come whenever you travel to an area which the infection is there in this way. She might open up and tell you, yes, doctor, I have traveled to any country like in Asia or India or whatever, Nigeria or Africa, any country which known to be endemic for tuberculosis.
Highly. Oh.
Okay. You can say in this way, but don't ask her, do you have any travel history? I should know. Don't ask as a question. You can just give her
Ah,
the possible
only as
example.
information. Don't
Exactly,
ask.
yes.
I did.
Yeah,
Oh.
she will tell you, yes, doctor, really, I had a travel 2 years back to a country which I contacted with sick patient, my cousin, my uncle, whosoever. So you can tell her that, yeah, this is could be the reason of having this
Mhm.
infection. Okay. Or as you said,
Mm.
any contact with someone who's coughing and who has some symptoms of chest infection.
Yes, because also in travel by contact.
Yes, exactly.
Yes,
Okay.
yes, yes.
Then
Mm.
the pathophysiology, the manifestation, what the patient will present, the same as you have loss of weight, loss of appetite, night sweat, and the night fever. Then the complication. You didn't explain the complication unless she asked you, doctor, what complication might happen?
Mm.
You said only scarring of the lungs.
When I start to explain, I explain everything,
Not
definition,
everything. By
symptom,
the way,
complication.
it will take, yes, you should
Uh,
give her some complication, particularly the serious complication. Why the serious complication you have to explain? What do you think the importance of saying serious complication? Like it might affect your breathing and you'll be difficult to breathe. It might spread to your lung, to your tummy, to your head. What the importance of saying those things?
mhm.
What do you think? Why we should do that? I'm asking you.
Um,
Is it important to say serious complication or only
yes,
to
yes,
say
yes, yes,
it's a
important because
light
the patient
infection?
athlete can be convinced and can be willing
Exactly,
for admission.
yes.
Yes,
Perfect.
yes,
So this is the way to convince a patient who's having TB
yes.
to start the medication, not only to start, even to be compliant to the medication. Otherwise, she will be non-compliant. She will not start. She will tell you, doctor, I'm having kids. I have travel. I want to go there. I want to do something. I have business. She will not convince unless you tell her it might affect your breathing in the future, and you might not be able even to breathe. And I'm so sorry, it might threat your life. Okay, so
Mhm.
in any infection or any condition that can be progressive, you have to use it as a convincing point. I am sorry, you have to be to do so because it might do this complicate by this. Okay, then if she agreed, you can ask her, what do you think about that? Are you agree to be admitted? She will tell you, no, doctor, I have some problem. I have kid. You can solve this problem, or you can tell her, we will try to solve this problem. But any problem in the hospital, no, doctor, I don't like to be in the hospital. I don't like, or whatever she will say, you have to address. But if she's agreed, so you will tell her, yes, you'll be kept isolated for almost 2 weeks, at least up to 3 weeks, or if the result showing that you don't have this bug in your phlegm, you might be out of this isolation. I have kid, doctor. You can ask someone to take care of your kid. What about your cousin? What about your neighbor? Whatsoever, just to solve this issue. If she said, I have some business, some job, you can give her sick leave, but you should isolate her. This patient, if not isolated, she will go away and she will spread the infection to the kids in the school and to the family, to the child, to the husband, to the mother. Okay. Then the point of the
Yes.
job. She is a teacher. What do you think? No, yes, we have to screen the kid one by one. Is it your job?
No,
Yeah.
only
Th-
ethics,
This is job of what? What office?
infection control,
This is public health office job.
public health
Infection,
office. Okay.
yeah, infection control in the hospitals or infectious disease. They will take care of the infection, the antibiotics, the isolation, the precaution, all these things. Outside the hospital, who's having contact with the patient, they will be screened by the public health. This is not your task at all. Because if you explain more, it will take more time, okay? And this is not your task. But you have to screen or to mention it. Okay, we already informed or contacted the public health. They can take care of this point regarding the children in the school. Okay, this is the
Mm.
regarding, but you have to mention them, infection control as well as the public health team. Okay, anyone in your family
Mhm.
having the same symptoms, please let them come to us.
Yes.
Then, yeah, the what else we can speak? Yes, the medication. You didn't tell about what she should start on. Do you think the isolation only is the treatment? You didn't say
No,
even there
medication
is.
also.
You mentioned. I'm sorry if I didn't hear.
No, I didn't mention name of the drug. No,
Not a
I
name.
didn't
Not a
mention.
name. Not a name. It's a
Mm.
regime of medication, group of antibug, and we will arrange another meeting with you to give you the names and more instruction about the medication, what the possible side effect, how to take this medication. Because if you explain one by one, the time will beat up. Okay, this is
Yes.
a major task. There is explanation of the disease, the infection control, the public health, the job, the occupation, the social, the isolation, the explanation. You don't have time to even explain the medication in detail. So yeah, there is medication called anti-TB medication or anti-tuberculosis. Don't bother about the name. We will give you another meeting or a time appointment for another meeting to know more about this medication, how to take it, and if you have any concern, we can address it in another meeting. At least
Mhm.
you explain what she should do or what she should take. It's not the matter of isolation only. Okay?
Mhm.
Yeah,
Okay.
that's it.
Thank
I
you.
think, yeah, this is in details, but try to minimize the jargon. I think you mentioned some of them,
Mm.
if I'm not mistaken. I cannot recall it now. Dr. Lamis can help me.
Yeah,
Can you
she
remember?
mentioned
Yeah.
when she was talking about the complications. So she mentioned
Yeah, she
like
mentioned the
stenosis,
fibrosis. Stenosis, exactly.
fibrosis.
Thank you for reminding me. Yes, these are the one. So stenosis, you can say narrowing of your
Narrowing, yes. Okay.
yes, air pipes. Okay, air pipes
Mm.
narrowing, and this fibrosis, as you said, scarring of the lungs. Not only
Mm.
that, even the scarring might distract your lungs. And I'm so sorry if you are not compliant to the medication and taking the medication in regular way. This bug might be more resistant to the antibug, and the distraction will be more and more, and it might threat your breathing and your life. This is the way how to convince any patient to take any medication or to be isolated or to be admitted, and she's taking this disease lightly. It's just infection, doctor. No, it's not just infection. Yes, it's curable one, but if you don't care, if you don't take care of it, it might be more progressive. Okay.
Mm.
But the good news, it can be cured or can be controlled by the medication. But under
Mm.
one occasion, if you take your medication for the full term, 6 months, and in compliant way. Okay.
Okay.
Okay. Thank you,
Okay.
Dr. Salma.
Thank you.
Now, well, thank you. Any question, Dr. Salma, before reading the other scenario? Do you have any question, Dr. Salma?
No, no, thank you very much. Thank you, doctor.
Okay. Okay. The second scenario: 22 years old man, recurrent episode of fainting, was admitted to the acute medical unit after episode of syncope in this supermarket. This was his third episode of syncope in the last 12 months. The first episode occurred at train station in a train station. So there is some echo. I can mute. From whom this sound echo? Okay. The train station, and the second in stopping in a shopping mall. All three episodes were similar in that way, and that they were preceded by several minutes of lightheadedness, nausea, and sweating. The only happened when he was upright. There was never any jerking of his limbs, tongue biting up, rolling up the eyes, frothing at the mouth, or incontinence. He didn't experience chest pain, palpitation, or breathlessness prior to the episode. The same copy was not brought on the exertion or rising from spine's position. He recovered consciousness in less than a minute. On every occasion, he was exhausted for several minutes after the episode, but never drowsy or confused. He didn't seek medical advice after the previous two episodes. His medical history is otherwise blameless, and he's not taking any regular medications. He doesn't smoke, drink alcohol, or use illicit drugs. There is no family history of epilepsy or sudden cardiac death. He's single and sexually inactive. He is looking for a job, having recently graduated in hotel management. His physical examination was entirely unremarkable. There was no posture drop in blood pressure, no cardiac murmur or neurological deficit. 12 lead ECG and echo were normal. Continuous ECG monitoring didn't reveal any arrhythmias. Blood sugar is okay. Presentation was felt to be in keeping with vasovagal. Yes. So what I read is the same taking history for a vasovagal attack. The same presentation. Okay. I mean, this is full take history of vasovagal attack. Anyone want to read it or to summarize the vasovagal attack? It will be the same as I read. Okay, this is the scenario I mean. Okay, you are the registrar, medical registrar in the acute medical unit. Your task is to explain the diagnosis of and management plan to him and his mother, who has come to take him home. 22 years old man. Okay,
Yes.
let's assume his name is John Smith.
Hello,
Okay.
my name is Dr. Osman. I'm one of the doctors in the acute medical unit today. May I confirm you are Mr. John
Yes.
Smith and you are 22 years old?
Yes.
All right. Mr. John, I'm here today to discuss your health condition. Is this all right?
Okay.
Mr. John, I might be taking some notes, but I will ensure that these remain confidential. Can you know about your health condition so far, Mr. John?
Yes, I am suffering now near 1 month, around near 1 year, around 12 months. I developed 3 episodes of syncope. First one happened in the supermarket, second one happened in the mall, shopping mall, and before this is syncope, I feel nausea. I feel also like headaches, and I feel sweating also, and nothing
Right,
otherwise.
okay.
And after this, episode, minutes I will be okay. And I didn't seek
Right,
medical
okay.
advice in the two very first episode. Yes.
Okay.
So I want to know
Thank
what
you for
happened for
sharing
me.
this. Right. Thank you for sharing this information with me, Mr. John. And I'm really sorry you went through this in the past 12 months. So, based on your symptoms and what you have told me, you came and you have been assessed by the heart doctor. They examined your heart, they checked your blood pressure, and you also had examination of your nerves as well as a tracing of your heart. Um, they also checked last time you came the blood sugar in your body, and I have the results of your test with me now.
Okay,
Okay, right.
okay,
I'm very sorry, Mr. John, to tell you that based on these test results and the history you have told me, you have something called vasovagal attack. Have you ever heard of it?
no, can you tell me what this is?
Right. I'm very sorry, Mr. John. I understand that you must be very concerned and very frustrated, but let me explain to you what's happening. So, a vasovagal attack, or it's a fainting attack, don't mind the medical term, it's a fainting attack. It happens when your body overreacts sometimes to certain triggers like any sudden pain, any emotional stress, any unpleasant thing, or sometimes even standing for a long time or being in a hot environment could trigger these kind of fainting attacks for you. So what
Okay,
happens in these attacks, Mr. John, is your heart slows down and then your blood pressure drops quickly. So this reduces the blood flow to your brain for a short moment, giving you these fainting attacks. But the good thing is you recover quickly and you get back. Are you following me?
yes, is this serious?
Right, okay. This is reassuring, particularly that we have examined your heart, and we did some tracing of your heart, and we checked for any other causes that give the same symptoms, and we have excluded these. So generally, these fainting attacks or vasovagal attacks are harmless. People recover fully without any damage to their heart. However, there are some precautions that we have to take. Like sometimes, like you've told me, like you fainted or you had this attack in the train station, sometimes in the supermarket. So you could have some injuries from the fainting or the falling attack itself. Um, so um, that's one of the concerns. Like if you know,
Okay,
like
is there anything can be done to be prevent
right.
this condition?
Yeah, so we have a management plan for you, Mr. John, and the management plan will be supervised by the heart doctor and specialized nurse. So there's like general advice for you is, like I explained, there are certain situations and certain triggers that bring these fainting attacks. So if we can like reduce these triggers and learn like how to deal with these emotional stress and pain, the triggers for these attacks. Also, sometimes if you feel like you need to stand for long times, then you have like to sit and rest for a while to avoid having these fainting attacks. Also, dehydration and not drinking enough water. So ensure that you are always hydrating, particularly in like hot weather. We are also going to teach you some maneuvers. Sometimes there are some maneuvers that you can do to increase your blood pressure and recover quickly from this attack. If all of these do not work with you, then there are some medication that the heart doctor can prescribe to make your condition better. How does this sound to you, Mr. John?
Okay. Um, is this condition can continue with me for life or can be treated?
Right. So I'm not really sure about the answer right now, so I have to consult. But generally, these have like very good uses. If we can these trigger, then we might reduce the frequency of these attacks coming. If you take, you hydrate well, you avoid standing for long periods, and then you identify the triggers that give you these fainting attacks.
Okay, thank you.
Right. Do you have any concerns or questions,
Yes, I can drive.
Mr. John?
Yes,
Right,
yes, I
okay.
can drive.
So you have right, okay. So you have to stop driving for now, and then we will let you know when it is safe for you to drive again. Okay.
Okay,
So can I ask you a few questions, Mr. John?
okay.
What do you do for a living?
2 minutes left.
I am a accountant in a bank.
You're an accountant, and how are these symptoms affecting your job?
Um, it's a little. I'm going for my duty, but sometimes this is syncope happen when I'm standing long time or
Right.
uh,
Okay.
yes.
I'm very sorry to hear this. If you need any help, then we can involve the occupational health if you need any help. And may I ask you if you smoke?
No,
Do you drink alcohol?
occasionally.
Right, okay. Mr. John, as I mentioned, we are going to have another meeting to speak in details about those maneuvers that can help you and discuss in more details those triggers for these attacks. These fainting attacks are generally harmless, as I mentioned. However, I'd like to tell you if you feel this is happening during exercise, if there's any experiencing any chest pain, any racing of your heart, or shortness of breath before fainting, then you have to come back to the hospital and see a doctor quickly. For now, I'm going to give you some leaflets and some brochures with more information about these attacks and the phone number for the department. If you need any help, you can contact us.
Thank you.
Okay. Do you have any other questions or concerns?
No.
حاسة إني ناسية حاجة. I think I forgot something, but I'm not sure.
No, it's a really great one. Wonderful. You did it perfect. I will correct some points, but Dr. Salma first, then I will comment.
ما شاء الله good good. هو كله تمام. No, no, no. I think nothing. Only about point of driving. I think no need to stop driving because this is syncope or fainting has precaution. I mean, before Comm, there is headache, like alarming to stop, alarming to do something before syncope happen. So I think no need to stop driving. Only take precaution.
Okay.
Then also can be either or syncope can be either vasovagal or cardiogenic or botural. This patient all is normal, nothing in the heart problem, even no botural hypotension. So uh, uh, I think no need to be follow in cardiology clinic as you mentioned. I think you mentioned that need to be follow in cardiology clinic or something like this.
Yes, I said yes, the heart doctor.
Okay, we will listen other comment about this point also. Thank you.
Okay.
Yeah, thank you, Dr. Salma.
To be honest, I'm not sure. I wasn't sure about the driving, but I
Yes,
remember I've seen like with 1 month. I wasn't like really because I haven't reviewed this information recently.
yes, I will fix this. Okay. Thank you, Dr. Lamis. Really, it was amazing one. Perfect. Apart from driving, so no need to stop driving unless he had this episode while sitting, or he has it while coughing or stress or sneezing, because there is some types of vasovagal happen with stress, but usually the usual one and the classical one happens when standing for long time or when he's standing with dehydrated state in hot weather. Usually this is the vasovagal attack, and this is what usually happen. But in only situation he has it while sitting, for example, and it's a very rare one. This type only of vasovagal, the patient might stop driving. So it's okay to say we can hold the driving right now unless you have it while driving. If you haven't, if you have it before while driving or in the future, please contact us. Because if you can see in the scenario, he had it while standing, while doing shopping, while waiting in the train station. Usually, this vasovagal attack happen. Okay, so these are the trigger. As
Okay,
Dr.
okay.
Lamis said, the dehydration, the water, and she gives some instruction regarding taking plenty of water. Don't stand long time, even if you want to stand from sitting or while sleeping. Don't do it once. You have to sit for a while. And whenever you feel blackout, please sit down immediately in order not to have the vasovagal attack. Okay? So it usually happen whenever you stand suddenly or whenever you are standing long time or you are in hot weather. Be careful about these situations. Take care and usually have a seat. Don't stand for long time. Plus the water. Some people they might have improvement with the stocking to help the venous return. And you can say that also along with this instruction. I think this is the only part that was mismanaged by Dr. Lamis. Otherwise, she gave good instruction. She delivered the information in good way. She communicate all the scenario well. Really perfect one. I don't have other comment. Anyone has question or comment to add, he can add. But I can give Dr. Lamis full mark apart from the point of driving. So if you don't know Dr. Lamis, if you are not sure, you can say I will contact my senior, or you can contact DVLA, or I will review the guidelines, rather than saying I will stop your driving, because vasovagal usually they are not stop. Okay, clear?
Okay.
You have any question, Dr.
Yes,
Lamis?
clear. Thank you, Dr. Bassem.
Okay. Any
No,
comment?
thank you.
Okay. Let's go to the comment. Dr.
So
Salma, you
just
want to add any
like
comment
one
or
question
question?
before Dr. Bassem, just before we move to Dr. Salma, and Dr. Salma as well. So she asked me if these are going to disappear, like the vasovagal attack, and I said
Yeah, good.
I will generally speak to my senior. Yes. So what's your comment? Like, what's the best way to answer
Yes,
this
one of the best
question?
ways, yeah, I will answer this one. One of the best way to ask my senior. However, if you avoid the triggers, these attacks might not happen again. Okay, but it will be fully recovered. I don't think in medicine. I'm not sure, really, to be honest, that it will be disappeared. It might be there as long as you have the stress or the trigger that can lead to the vasovagal attack. Because you can hear about all ages having the vasovagal attack. It's
Okay.
not a matter of young or elderly or middle age. So it can affect all age group, right?
The same way I
Clear?
answered. You
Yeah, but
say,
you answer it in perfect way. I will ask my senior,
yes,
but the most important is to avoid the trigger,
to
which you
avoid
did
the
already.
triggers.
Yes,
Is it safe to say like it's difficult to tell whether these are going to disappear, but generally if we control these triggers and
yes,
we try to manage as I have explained to you, then it is very less likely that you're going to have these frequently.
exactly, perfect. And the explanation was perfect, really, when you said the blood flow to the brain affected and the heart beating along the blood pressure going down was really amazing. The explanation is the perfect, simple, and this is the ideal way to explain the vasovagal attack.
Okay.
Okay, thank you, Dr. Lamis. Let's go
Thank you.
to thank you too. Any other question or comment or concern you want to address it? Clear? Dr. Salma also, if she has any concern.
Thank you very much.
Okay. I will try to read the comments. Dr. Omar commented from first scenario. Regarding the management isolation, isolate the patient when possible. If the patient has house with closed room, then can be allowed following certain approval and assessment of the patient ability to execute the plan and hold the information. In reality, less likely to happen as usually TB patients are low socioeconomic with social needs, so it will be always in patient isolation at infectious disease ward. Perfect. That's why don't open this door, Dr. Omar or anyone. If you open and give any approval, there is another alternative, you will be in trouble. Already, she mentioned to you that I have a child. So it's impossible to isolate her at home and never ever the child will be away or she can take the all precaution. Plus, the child immunity is weak. Easily, he can take it or he can gain this infection for the mother. And unfortunately, the disease might affect him more harmful than the mother. Okay. Second point, reporting to infection control team for contact tracing, hours work, different to infectious disease team. Not public health department may be permissible to say that overseas, as this is the typical practice. So infection control different than the infectious disease, yes, for antibiotics and so on. For the contact tracing, you want to say infection control, but here is in our countries in the Middle East, it's public health. They are the one doing this. Other teams will be involved. Infection disease micro are the parent team and they lead the TB clinic. Respiratory will be involved when complication happens, of course. So you can say lung doctor along with the infectious disease team who can take care of the course of anti-bug. Will write your occupational health at your workplace. They will be copied in your discharge letter. In hospital, it's not usual to provide for sick note. This is usually being managed by the GP. Anyway, the patient now at your department, so you can refer to the GP and to give him sick leave, or you can write that she needs to be taking sick leave. But the role here not to be back to her work as long as she had the infectious.
Yes, Dr. Bassam, I was writing this for the
Yeah,
candidates that are giving the exam in the UK. So those are
yeah,
different phrases. I understand it's different, totally different. It's just a reminder for myself and
yeah.
all colleagues who are giving the exam here. So you can't say I will give you a sick note because it's not the typical practice that you are in a secondary or tertiary healthcare. You don't provide sick notes. You
Mm-hmm.
will write to the you usually leave the patient with a discharge letter, including the plan, everything, and you can copy every other team in the in that, and the discharge letter itself can be used
Document for sick leave.
to
Yeah.
yeah because usually here you can call in sick with your employer, let him know that you are being admitted, and the discharge letter is the proof of your claim if you are absent from work for more than 7 days. So you are allowed to self-certify for less than 7 days, more than 7 days. You will need a fit note from the GP, and the GP to issue the fit note, he needs to see the discharge letter.
Discharge. Yes.
So
Mhm.
it is completely different, but it's not for the overseas candidate. Don't worry about this. What I wrote
Yeah.
is just
Yes. Yeah, I think here it's different and separate form, which is the sick leave. Anyway, the discharge here, it might include the sick time or sick note, but usually they are giving separate sick leave as a separate, different than this discharge one. Anyway, almost similar, but you have to be aware also about yours, and we have to be aware about ours.
I
I
know
think, yeah.
UK is the capital of bureaucracy in the world, so
Yes, yes,
so
sure, sure. They are a little
it's
bit
bureaucratic.
complicated. Yeah, they are
Yeah.
complicated on those things, but they are also regular, doing
Yeah.
the guidelines, and we are usually following them. Anyway, we are trying to learn here and there, and every country has the own guidelines for themselves. So we cannot comment on every country, but usually make it as a habit. You can do provide this letter whenever you have patient. You have to prohibit him to go to the work. He might infect others. So you can, if he's worried about the work, we can tell him we can give you a letter, or you can say also sick leave or whatever you want to give to him, but he cannot go to his work back. Okay. For the next comment, yes, HIV should be assessed notifiable disease. Assess home status for possible home isolation if refusing admission. Again, it's an option, but don't open this topic with the patient. Let it the last solution whenever he insists or she insists to go home. But the main and the default here to isolate the patient at hospital, particularly if they have not ventilated room, they have kids, they have a sick mother, they have the career of her job, contacting children, all the things will not be safe for the patient to go back without isolation. For the next comment, Dr. Omar commented, if you have recurrent episode, even with a prodrome, you need to inform the DVLA. In heavy group vehicle, group 2, driver it's always stop driving. Explain syncope attack that it's recurrent with prodroma, needs to stop driving for 12 months.
This is
Uh,
what's written on the DVLA. If you have explained syncopal attack, that it is recurrent even with prodromal symptoms, you need to stop driving, inform DVLA, and the stopping is for 12 months. So I,
This is
I'm
as
not
syncope.
sure.
No, this is
The,
as syncope, not as a vasovagal attack. We are talking about vasovagal as a separate topic.
so
Syncope,
vasovagal
which is,
falls under syncope in the DVLA guidance. So this
yes,
is from the DVLA, copied from the DVLA straight away under the vasovagal
but let me
sections.
correct the things, Doctor, and fix the things, Dr. Omar. Vasovagal, yes, it's part of syncope presentation,
Yes.
but not all syncope will be vasovagal. You got
Yeah,
it?
of course. Yeah, of course.
Okay. So the vasovagal itself, if diagnosed appropriately, those patient doesn't need to be stopping driving. This is what I know. Yes, if there is syncope, still not diagnosed as vasovagal, absolutely right. You have to stop driving because you don't know what will happen, why it happened, unless it will be diagnosed and you roll out all the pathophysiology and any other condition like epilepsy or cardiogenic or something related to the hemodynamics like Addison, that time you can stop driving. Okay. If unexplained and still not diagnosed as vasovagal, everything came as negative and you diagnosed vasovagal, so it happened only while standing, according to the type also of vasovagal. Is it with the coughing or with standing or with hot weather? So all these things can give you a clue to stop or not. But the classic one, you can let patient drive. This is what I know. We can revise again and again to update in the group, or anyone has update about it, he can update it in the group, the WhatsApp group. But this is what I know. The
Mm.
vasovagal itself, you cannot stop diving because never ever it will happen while sitting. Why it should happen if you are sitting?
If so, Dr. Bassem, so
Yeah.
you are explaining here. I'm talking about here. You are explaining literal words of flow. Literal words of flow is the vasovagal syncope classified as syncope? Yes. So it falls under the law of syncope. So when the law of syncope states that the syncope, if the syncope is explained, which is in this case is explained by vasovagal attack, but it happened in more than one occasion. Okay, so it is recurrent, even though if it is with prodrome, so they are writing it in that exact wording. That needs to stop driving, inform the DVLA, and he will need to subject to further assessment. So this is if you are, to be honest, if there is any doubt, you can just simply state that I will review the guidance, but likely you might need to stop driving. I'll
Okay.
just make sure, but
Oh,
the
yes, better to
in
be
that
sure and to refresh it in the group. I will ask you a question now. How to diagnose vasovagal?
if it's myself, I think it will be after excluding all of the possible causes, either whether it's cardiac or neurological,
Okay, we
and
roll
the
all them
symptoms
out. Yes.
and
What
the
do you think?
symptoms is consistent of
Okay,
with that. But vasovagal, is it happening because of panicking? Does it happen with
exactly. Yes. Yes.
stress? So
Okay.
this can happen while it's driving. She might be
Yeah,
taking a
that's why I
call.
said there
Yeah.
is a classical one and there is a variant of vasovagal. But the classical one, which happen while you are standing, and I'm talking about tilt table test. It can be diagnostic for those people who's.
Yes.
Yeah, so if you have clear diagnosis of vasovagal, which is the one coming or happened while the patient is standing
Change
for long,
position.
yeah, or the other one like emotional or coughing with stress. So accordingly, you can say this patient never ever will have it while sitting, and that other one who's coughing, he can cough or sneeze while sitting, and he can be having this attack while driving, so you can prohibit him. But I'm talking about the classical one, which is happening while standing long, or as I said, in hot weather. You got my point.
Yeah, yeah, yeah.
Anyway, we will revise both. Anyone has another opinion, we can share it. Dr. Al Shayma, let's read this comment. Maybe clarify. For group one, no need for notification. It has known trigger like long standing with prodrome, but for group two, need to notify. I read it now. Thank you, Dr. Shema. So we usually are talking about group one. Unless the patient is saying I am doing the job on a bus or on a heavy vehicle, definitely those people who have risk, to harm others, yes, definitely you have to stop them. But we are usually talking about type 1, which is own car, and he's not that much doing the job on his car. Even the taxi driver, you can talk about taxi driver like he's working for a long time. Yes, you can tell him inform DVLA. But the one with his own car, just going from here to there, from their job to the home, he's not having long trip or long time for driving. It's safe to say to him, yes, you can drive. Okay, so type 2 usually longer than the type 1, or even they need to inform DVLA more indicated than type 1. Be sure that you are
Okay.
saying, yes, you have to inform DVLA in type 2. Yes, Dr. Omar, you want to say anything?
Yeah, I'm saying, yeah, so
Yeah,
in the classical one, you are saying that it is not a problem to for him to drive if he's falls in the classical presentation.
exactly. Yes, yes. And Dr. Shema confirmed that with us.
Good.
Okay, but type 2 are different. So don't say for type 2 it's safe. We are usually saying that for type 1, okay?
Mm-hmm.
So we can thank Dr. Shima for confirming this information, and we can ask for any comment before ending the session. Anyone has a comment or question? You want to add anything, Dr. Omar?
No, the both cases was very
Yeah,
very good. Yeah, very
yeah.
good.
And very common. The first one particularly is common one, the TB.
Yeah, the TB comes in
Yeah,
everybody.
exactly. Okay. Thank you, Dr. Omar, for sharing the comments with us. Thank you, Dr. Salma, Dr. Lamis. Thank you, everyone, for the attendance. See you tomorrow, inshallah, with the short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much, Doctor.
Thank
Thank you,
you.
Jazakallah
Dr.
khair.
Bassem.
Thank you.
Thank you. See you tomorrow, inshallah.
Thank you.